Hair loss and baldness treatments and procedures. Treatment. Supplementation can be considered for a prescribed period so that nutritional status improves. Doctors may recommend medicines like finasteride, multivitamins, solutions like minoxidil, which can be applied to the scalp and may work by increasing blood flow resulting in nourishment to the hair follicles. Though, it can do very little for follicles that have already become inactive. This treatment is recommended at an earlier stage of hair loss for more favorable results. Procedures. PRP, platelet-rich plasma therapy for hair loss, is a three-step medical treatment in which a small quantity of patient's blood is drawn, processed, and then injected into the scalp. It promotes hair growth to make the hair denser and stronger again. How does PRP work for hair? PRP injections trigger natural hair growth and maintain it by increasing blood supply to the hair follicle and increasing the thickness of the hair shaft. Sometimes this approach is combined with other hair loss procedures or medications. Mesotherapy. Mesotherapy is a technique which involves microinjections that uses injections of vitamins, enzymes, hormones, into the mesoderm or middle layer of skin to promote healing. Micropigmentation. Scalp micropigmentation is a non-invasive treatment that uses detailed microneedles to deposit pigment into the scalp. The result creates the appearance of tiny hair follicles that help thicken and restore the look of fuller hair. Hair replacement options. Wigs, patches, and other hair replacement systems have several side effects like itching, maintenance of hair, permanent baldness, etc. They are not long-lasting and need to be replaced timely basis. You cannot straighten or curl them. There will always be an unnatural shine on your hair wig. More challenging for some individuals to manage as they can be more difficult to style than human hair. What makes hair transplant the best solution for hair loss? Hair transplant is one of the most effective options to restore hair as it involves harvesting follicles from the back of head which are DHT resistant and transplanting them to bald areas. There are techniques like FUT and MHI which are used for hair transplant procedures. Vplant Hair Clinic uses the latest techniques like MHI, modified hair implantation, to regrow natural hair, which is a minimally invasive process, safe, painless, scarless and long-lasting. The patient's healthy hair is used for the growth of new hair. At Vplant Hair Clinic, our highly skilled and experienced hair transplant surgeons can recreate a bald head into a head full of hair. Advantages of MHI. Permanent solution. Less invasive and safe cosmetic surgery. Rapid recovery and no need for admission. For any hair concerns you can call us on 981-151-6411. We have our branches in Mumbai and Kerala.